Hello, good morning. How are you guys doing? It's the 26th of July, 2020, and it's good to be back on a Sunday morning. I hope you can hear me clearly. Excellent. So this today's event is going to be special because we're going to be doing women's special. We're going to talk about just setting Instagram too, so that we can go. It's a good topic to do because we're going to do colorectal problems in women, and this is particularly a problem because women find it difficult to open up, and including men. We're all shy to talk about personal health issues with anyone, for that matter, even if it's a doctor. But women in particular have some anxieties, and and it's across societies, not only in India and in the UK where I trained. Women found it difficult to come along and speak to doctors in particular about their anal problems in particular. So any health issues, but this was particularly an even bigger problem because it was embarrassing. As a result of that, several conditions were missed, or they delayed their treatment, and that got them into lots of trouble. So what we're going to do today is to, this is a open freewheeling chat. People can ask questions in the chat box, and we will, answer as many questions as possible. But I'm going to go through the entire gamut of colorectal problems in reference to women, what I've seen in my last 23 years of practice in this specialty, because they come with a specific set of anxieties and due to all sorts of reasons compared to men. Men also have these issues, and they also feel embarrassed. But let's talk about women. So I'm just waiting for all people to join in. I see a lot of my friends online. That's great. Let's go through here. Hi Nityavashini, hi Anushya, hi Vimala, Ritesh, hi Binti, hi Annie, hi Leena, hi Murugan, hi Kaushik, hi Amita, hi Dayanan, hi Mr. Bardhan, Pugam Mara. So several other people joining on Insta. That's great. So I'm just waiting to set up my Facebook thing, and then we'll get started in a minute. Okay, right. Okay. So just give me 1 minute. Okay, so keep the questions coming. I'm going to start in 1 second, just setting up the okay, I think we're dead. That's good. Okay, so let's start with women problems. As I said, we're going to talk about colorectal women problem, and there's a specific to them. Let's start with pregnancy. In pregnancy, in particular, women tend to get constipated. Okay, that's because as the baby grows, that is one. It occupies more on the space in the abdomen, and that is one. Second thing, the diet changes. They don't feel like eating. They're not drinking enough water, so they get constipated. They find it difficult to evacuate. So it's a very common problem. Okay, so you need to talk to, if any of you are pregnant, you need to watch your water intake, your diet, eat lots of vegetables, cut down on the red meat, as I always advise you. And I hope my audio is clear, and if it is, just say yes, it's clear. Watch that. So the women tend to get particularly constipated when during pregnancy, and that's, as I said, because they're not drinking enough water, and also as the baby grows, it's they find it difficult to evacuate. So you may, once you watch your diet, you may also consult with your gynecologist, who may advise you on a better diet, keeping in mind the water intake. The second thing to do is to, if you get constipated, is to take some laxatives. There are several laxatives in the market. I suggest speak to your gynecologist, and there are nice simple ones which don't get in the way of the pregnancy or harm pregnancy. Simple ones, and that can be safely taken. Now, one of the two common things happen during pregnancy when you get constipated is: one, patients tend to get a fissure; two, they tend to get hemorrhoids, because you're constipated, you're straining, you're putting a lot of pressure, and it gets worse as the pregnancy evolves, right? So remember that. Now, always remember, there is a very rare chance that one could also have colorectal cancer, or particular rectal cancer, during pregnancy. I've seen that in my practice. It's more common in the West, where I got trained, but that does happen. I'm not saying you need to be worried about it. I'm just saying, if you look at the entire spectrum, if there's something worrying, always get a specialist to see a gynecologist, and they may refer you on to a specialist. But just keep that back of the mind. And it's not important. I'm just telling you, I've seen that. I'm not here telling that to scare you or anything, but awareness is important. Okay, so the most common thing is just people get constipated, women get constipated, and it gets worse as the pregnancy progresses, and they tend to have a fissure or a hemorrhoid. So, as I always keep telling you, hemorrhoids, painless rectal bleeding. They see, because the motion is hard, the cushions are swollen up and they bleed. And they also develop thrombosed external hemorrhoid. This is a painful condition associated with hemorrhoid. I know I've told you that hemorrhoids are not painful, but in this condition, they can be painful because one blood clot goes pop, and it forms a blood clot. Okay, so you can get a painful lump around the anus, as a thrombosed external hemorrhoid, particularly during pregnancy. The other problem is a fissure when this hard motion has made a cut. Okay, so there are specific ointments for it. Your gynecologist might be able to help. Sometimes I find that you may need to see a specialist to get the diagnosis right. Most of the time, if you increase your water intake and also increase your water intake and watch your diet, this symptoms will settle down, and you can have these ointments for the fissure, which will help you with healing the fissure itself. So my practice is that during pregnancy, I try to manage patients conservatively, because women are going through the pregnancy, and you don't want to do a procedure in the middle of that. Not you can, if it's an emergency or it's an abscess, you can develop an abscess, perianal abscess. That's another thing which again develops into the infection, which can cause fistula. But these are, these two, hemorrhoids and fissure, the common things which I see. Fistula, abscess, yes, sometimes you may need antibiotics for that. So again, we need to cross-check with your gynecologist to put a safe antibiotic. Okay, so most of the time with the diet, lots of water, vegetables, avoiding meat, healthy, fish and all that is okay. Just avoiding red meat. Usually you can settle it down and get through the pregnancy. And once the pregnancy is done, majority of the women, these symptoms settle down. But for some, they will linger on, and they'll come to the clinic and say, "Sir, I started during pregnancy. It's been a year and a half. It's painful." Obviously, immediately post pregnancy, they are busy with the baby, so they tend to not care about these things because they are happy with having the baby and busy with looking after the baby. So that's fine. But as long as you have some treatment and you don't suffer, because the whole point is avoiding suffering. That's what we're all here for. So we can manage that conservatively. Obviously, if it is very painful, if there is a thrombosed lump which is extremely painful, can't sit, then a surgery can be performed safely, and that's not an issue at all. But if we can avoid surgery, great. If not, if it's an emergency, it can be done. Okay, you can get an abscess, again, drain the abscess, and deal with it later. So those are things which can happen, and but to avoid those problems, the simplest thing would be to drink lots of water, have a healthy diet, and avoid red meat, and these three take care of those symptoms. Okay, so those are the things which happen during a pregnancy, right? What other things can have, questions? Okay, any questions? Fistula, okay. Okay, fistula is another important topic, particularly in women. As I've told you in a previous episode, there are differences between the anal canals in men and women. Okay, in the anal canal in men, the anal canal is longer and stronger, thicker in men compared to women. In women, particularly, it is it is sort of narrower in the anteriorly, which is where the vagina is. So imagine the vagina is there, the anus is there. So anteriorly, the thickness of the anal canal is slightly less compared in women. And so, as I told you, perianal abscess and fistula are one condition. Perianal abscesses are infection of the anal gland, which, these glands are inside the anus, which can get infected and form an abscess, and they burst out. Okay, and they burst out, they leave a tract, and that's called a fistula. 50% of the abscesses end up with a fistula. Okay, so that's that. Now, what are the differences between men and women is that men, as I said, have stronger muscles because they tend to be, by evolution, stronger muscles and, of the body frame compared to women. Now, with women, as I said, anteriorly, the vagina is there and the anus is here. The muscles in the front are, not very thick. They're not very thick, so they're thinner. So when you have an abscess around that and you drain it and you have a fistula, so as I said, there are several treatments which are there. The simplest would be to open the fistula tract. So we are more and more trying not to just lay open the fistula tract, because if you have to cut the muscle, and that may make the muscles weak, which will result in incontinence. Now, the problem with that you leak stools and gas, when you cough, sneeze, and it may be okay now, but as you get older, the muscles get weaken further, and that becomes a bigger problem, right? So ideally, we should try to preserve the muscles. So when you develop a fistula, or an abscess, the abscess needs to be drained, and if it's a small tract, we can lay that open. Now, if it's a longer tract and it's complex, then we can do sphincter preserving endoscopic surgery. Again, the success rates are limited compared to laying open, but the laying open can damage the muscle. So that's which we need to. That's why you need to see a specialist for anal fistula surgery who does these things for a living, rather than people who do it once in a while, because it's important, particularly for the patient. Now, anteriorly placed fistulas, anteriorly means which are close to the vagina. Those are the ones which are challenging, as I said, because there are a few things there. One, even if it's a fissure, as I said, the muscles are thinner and shorter in women. So if you're going to cut any muscle or do any surgery, we need to worry about incontinence, because the muscle bulk is less compared to men. Okay, so you've got to be very, very careful. The second thing is that during pregnancy, most of who had children or are going through pregnancy, to understand that when the baby comes out, normal delivery, everything goes on great. Otherwise, sometimes they will do a cut near the vagina, which is called an episiotomy, or sometimes they put forceps to it to extract the baby, because the head is large, or baby is big. So when these things happen, you can damage the muscle, okay? Because you're removing to the vagina, the anus is just behind, or mostly when you cut, so on the edge, the muscle is there, right? So the episiotomy can be graded into different, you don't need to know the technical details, but the muscle can get damaged, okay? So, but it can be repaired. Usually the gynecologists repair, and they're well trained to do that. That's great. But sometimes because it's a dirty area, because the anus can puts out fecal content, and that can get infected, or sometimes the muscles can spring open. Most of the time it's fine, but sometimes it can cause trouble, and it can result in weakness of the anal muscles, leading to incontinence later, okay? So that's why it's important, when you're dealing with fistulas, or dealing with anteriorly placed fistula, which are close to the vagina, it's always needs to be managed very carefully in women, because if you have to cut some muscle, it's a compromise, and usually it's okay, but during pregnancy they might have more damage. 30 to 40% of the women who after normal delivery have some damage to the anal canal muscles, okay? That's as much as that, 30 to 40%. So in Western countries, at 3 to 4 months time after delivery, there is a questionnaire which we used to in the pelvic floor clinic. The pelvic floor clinic is run by a colorectal surgeon, the urogynecologist, and a nurse. And basically a full history is taken at that time. This is post-pregnancy, because of the damage it can happen, and the patients ask questions about incontinence, passing of glass, so fecal matter without knowing. There's a questionnaire, there's a grading there, but you will be able to score the incontinence or any symptoms. So that usually happens 3 or 4 months after pregnancy. We don't have that kind of robust monitoring in India, but I think we should plan to. We one of the endeavors which we've been doing at the Apollo Main Hospital as part of the Institute of Colorectal Surgery is to try to start that service. It is a challenge, because the several stakeholders have to all get in. I think we're working towards that. Maybe the service exists, but it just has to be a bit more coordinated, because there are several specialists coming into play. So those are the things which you need. So what I advise people is that if you had anal fistula surgery and then you're going to have pregnancy, delivery, then there's going to be some damage to the muscle. So any anal surgery, previous anal surgery, I would say go have a cesarean section. That's as a colorectal specialist, because I don't want my patients who had previous anal surgery to have this normal delivery, because they would, there is a risk of 30% chance of damage to the anal canal muscles. So they would develop, incontinence symptoms later in life. So patients can say, no, doc, I'm happy, I'll just, wait and watch it, because the risk is only 30-40%. But some would say, like, okay, I'll have my cesarean section. Yeah, it depends also how the quality of the muscles are after this, before, post surgery, because the worry is that if any surgery, then there is some damage to the muscle, and it will get worsened post delivery. Yeah, so those are things which you need to be just to be aware of. These are things. The reason we're doing all the Sunday morning lives are, one, to catch up with my community, which is all of you. The second is to just to put in these important small things, which may be lot of technical detail, but it's important to just be aware of it. You may not need this piece of information, but somewhere somebody will ask you, and and particularly there will be lots of women post-pregnancy in the cities, in the villages, in towns who think that being incontinent, leaking gas or urine is normal, while it is not. Right? There can be something done about this. So if there is issues with incontinence and things post delivery, then if it's like because they made a cut, the muscles have sprung open, we can do a sphincteroplasty, which is restitching of the muscles, and improve the control. That we can do that. Or before that, sorry, that is one part of it. The more important is identified. We can do endo-anal ultrasound to look at the integrity of the muscles, the pressures of the muscles. All these tests are available in Chennai at the main hospital, Apollo, and once these are done, then you will know most of the time. We manage them with physiotherapy, pelvic floor exercises, and biofeedback. These are exercises which are very important to sort of retrain the muscles to work more effectively, and that can be done, in Chennai or locally wherever you guys are. But sometimes all these cells are not put together. That's where some confusion comes. So the important thing to remember is that if some damage happens post pregnancy, you need to you can get help. That is the important message I want to send across, that to your friends and your family, that post pregnancy, if you have any symptoms of incontinence, or something is leaking or something not right, wound is not healing, please go see your gynecologist and get referred to a colorectal surgeon or a urogynecologist who can assess it appropriately and find out what's wrong. Okay, so that's that aspect, important aspect. Okay, very important aspect. Okay, so what else is we've talked about fissures in pregnancy, we've talked about hemorrhoids, we've talked about little bit of fistulas. Okay, I'll talk about fissures in women. So as I said, the muscle complex is thinner and not as bulky as in men. So particularly in young women, as I said, if during pregnancy there's going to be 30% chance of damage to the muscle. So I always worry about it. So if young women, fissures happen in very young, 15, 16, 17, 18-year-olds to, and particularly, common in between 17, 18 to 30, young women. I worry about doing the gold standard operation is a sphincterotomy. Gives great results, absolutely great results, 97% cure rates, and it's still the best operation. But you have to cut a little bit of the muscle safely, and usually it's absolutely fine. Now, even that, any risk, why, particularly in young women who haven't delivered or who delivered, as I said, have a risk of 30% damage to the anal muscles, possibly. So in that group, I prefer to advise them to have something called Botox, which people use for their face to get those little furrows out. These furrows are caused by muscles contracting, so you put the Botox, they relax, and that's why it lasts for some time, and you have to keep repeating the Botox on the face, right? You're not going to go into who is at Botox because it gets complicated. So we can use Botox because anal fissures are when muscles get tight. I told you there's a cut in the anal edge because of hard motion, and the muscles are tight. So that's when you push the motion out or the stool out, it hurts, right? So what we can do is obviously we'll give you laxatives, or ointments. Now, if that doesn't work very well, then the next step could be that we can give some, put Botox, inject that in the muscles. Okay, so it is slightly expensive medicine, but you need anesthesia and all that to put that. But the good thing is you're not cutting anything, and that the effect lasts for 6 months. And this is particularly used for young women who are busy working. They don't, you need to apply the ointment regularly every 8 hours and, continuously for a month. So they may not be compliant, because compliance is very important when you apply ointment for fissure every day, 3 times a day. If you're not compliant, it may not work very well, and then you'll end up needing a procedure. So that is one aspect of it. So if you so you inject the Botox and keep your motions free. 80% of the 75 to 80% of the time the fissure heals. That's what the quoted literature is. And so it's a safe thing to do. You're not cutting anything. It's simple, and it's well published in the literature. So my treatment plan for women, particularly young women who have anal fissures, is advice on diet, some laxatives, ointments. If that doesn't work, then we go for the Botox. Wait for 4 to 6 months for all this set. If it doesn't, then a sphincterotomy still is the best operation. If you say, look, doc, I want one operation or one procedure which will clear this pain, because fissures can be absolutely painful. They can be really painful. As there are people who've been pushed to sort of, depression and suicide because it can be so painful. So all I'm trying to say is, don't suffer. Get the correct advice. And the important thing is to get it examined by somebody who's a specialist. Now, it's women tend to go see a gynecologist when they have an anal problem. That's probably because a lot of gynecologists are women, and they can share their problems. Fair point. I don't have a problem with that. Now, if you come to me, I wouldn't know much about gynecology, right? I mean, I know basics, but I don't deal with it on a daily basis. So some gynecology may not, be dealing with anal problems regularly. So as long as they do a rectal examination, diagnose accurately, then it's great. If not, then you may need to see a specialist who's experienced, because these are subtle things, these anal fissures, hemorrhoids, intersphincter abscesses. And they can be challenging sometimes, and particularly in women where they're shy, embarrassed. Immediately when you try to examine, the whole anus goes into a spasm. In England, where we train, when we're not very clear for a examination, for a diagnosis because of all sorts of anxieties, we examine the patient under anesthesia, right? Under anesthesia, and we make that diagnosis, and then treatment goes on. Now, but again, it's part of the National Health Service where healthcare is completely free, and it's okay. Here, majority of us pay from our pockets, some insurance, it's a affordability issue or an insurance issue. So, so it becomes prudent that you seek the right person to diagnose the correct problem, and as long as you have whoever it is, maybe gynecologist, it could be a surgeon, it could be your general physician, they need to know, they need to rectally examine, and they need to assess the area accurately. That's what is important. Yeah. So, there's several people, there's argument about why see a specialist. See, the way I see it is, there are very few people who do everything very well, and there are few people who do some things really well, right? In between, there are all the others, right? So if there is a problem which you think is big, and big, it may be a small problem, but it's big for you, and you want the right diagnosis, you don't want to, you want the best person or the right person who's experienced in it, then go find that person. That's all I'm trying to tell you, So as long as you have, it could be a general physician who's so good, and, that's fine, But the point is to get the right diagnosis and the right treatment, because most of the time, if you do that early on, then most of these things can be sorted out very early. Okay, so we've touched upon all these issues of hemorrhoids, fissures. Okay, what else is there? Let's see if any questions are coming in. So, I have a wound in the perineal region. Usually, pus and blood remains healed for most days. It's accurate time of my. So Nityavarshan, yeah, it looks like a wound in the perineal region, usually discharging pus and blood, which there's a lump which just bursts out, then heals, and then again after some time it is active and heals. 99% it will be fistula in him. Okay, the treatment for that is you need to be seen by one of the specialists. I'm happy to have a look if you're local, and you will need surgery. Fistula treatment is surgery. Okay, just remember that. Fissures and hemorrhoids can be treated medically, and if they don't settle down, then they may need surgery. But fistulas will always, need surgery. Okay, right. That's that. Okay, so what else are we looking at? So we looked at incontinence. That's a big issue in women because they don't know where to go to for help because that's important, so who can help you with these issues is first you can speak to a gynecologist, you can speak to a colorectal surgeon, and there are urogynecologists or pelvic floor teams. So we have a pelvic floor team at the Apollo Main Hospital. You're welcome to contact us if there's any problems. You can come to the clinic in Ananagar in the evenings. Mornings we're at the Apollo. We have a questionnaire through which people go through these symptoms. So seek out help. It's very important. Okay, right. Now, what else can we talk about this morning? Okay, so as I said, cancer there's no particular preference. Men more or less similar incidence, but men rectal cancer seems to be more in men compared to women. There again, no particular differences. We've gone through colorectal cancer, so men or women. If there's a family history, then the children need to be screened. The brothers, siblings need to be screened. So that's important. As I said, it's important to touch on colorectal cancer symptoms, which are rectal bleeding, change in bowel habit, which is constipation or diarrhea, anemia, weight loss, lump in the abdomen for more than 6 weeks, right? So that's very, very important, very, very important. Men or women, but women in particular because they have more added responsibility. They could be going to work, they could be taking care of the home, children. So they tend to sort of ignore the symptoms or inform their family. So I think it's important to keep that in mind. Okay. So what else could we talk about this morning? So there's a question about what is diverticulitis. So diverticulitis again can happen so it's a women's special, I said, but it can happen in women. Diverticular so we're doing a diverticular operation next week, but it's in a man. It can happen in women also. The diverticular are little pockets which develop along the bowel wall. So bowel wall, mostly in the left side of the colon, comes with age. Mostly it's in the older age group, typically in the 50s, 60s. What it does is it causes lots of spasm. It can get inflamed, so cause abdominal pain. It can bleed. And it can sort of cause constipation and all those things. So what we normally recommend is if you have diverticular disease and you had 2 bouts of inflammation and infection which is causing pain, bleeding, and your bowels are abnormal, then you should have surgery to remove that. Okay, so that's diverticular disease. So another question about having surgery during COVID times. So as I said, so when this lockdown happened in April, we shut everything down, everything completely. From May, June, July, now we've been doing cancer surgery regularly and also acute problems. Now we've already started doing elective procedures in a planned way because now we know how to manage this COVID. As I said, COVID is not going to go away completely. It is definitely in Chennai, the infection rates have come down. In the district, some infection will be there because it's a viral infection. It is going to affect everybody before it settles down. So But as long as we wear a mask, maintain social distance, keep your hands clean. But if you think about it, most of these things are normal things which are expected of us, right? Keeping your hands clean, wearing a mask because there's lots of dust around, and people, bacteria, people. We haven't taken that seriously. Maybe this is nature's way of telling us to, look after ourselves, be careful, and also all this online education, consulting has all changed because you don't have to run. You can find your specialist or the best person to take care of you online. All the information is there, and that's what is a great change. So to answer the question, that the hospitals are slowly opening. There are COVID hospitals and non-COVID hospitals. Chennai city is doing much better than what it was, and we're starting to do elective work. So please reach out to me if there is if that could be of help. What we do is we for major surgery, we are admitting the patient, doing the COVID test, and then we're not sending them out, including the family who are attending or staying with them, and then all negative, say next day for surgery, and 3-4 days. That's for major cancer surgery we perform with robotics. For bottom surgery like hemorrhoids, piles, fistula, we are doing the COVID test and getting them admitted the evening or the next morning and having it done, then they can get discharged the same day. So that's not a problem. I think we've learned how to manage patients in this COVID period, and I don't think we should be worried too much. It's important. It's important to make this aware to all your friends and family, because lots of people are avoiding hospital for other more urgent things like heart attacks and injury to children getting injured. Because even in the UK, my friend, when I spoke to them last, the emergency or the casualty departments, they're not seeing children coming with fall, and okay, they're not going to school, but they're still playing around somewhere. So probably they're managing themselves. Sometimes you miss something serious. So particularly in the elderly who got comorbidities, diabetes, thyroid issues, high blood pressure, cardiac problems, please tell them the hospitals are much safer. We know how to manage COVID now. There are segregated areas, so the risk of you catching the infection is so less. Plus you're going to take all the precautions of the masking and social distancing and washing your hands. So staying safe and taking care of your other medical conditions is important. Okay, right. So that's that. Any other pressing questions? So there's several people who ask questions about anal surgery, and then it's not being perfect. So my advice to patients is that the anus, the anal region is like clockwork. Either you have cancer surgery or hemorrhoid surgery or a fistula surgery. Once you have surgery around the anal region, it's never going to be perfect. Okay, so that is why it's important to get the diagnosis right, try to manage it appropriately at the right time by the right specialist, and then if necessary, the surgery should be done by the most experienced person who's done a lot of these things. Because once surgery is done, as I said, even in the best hands, returning it to 100%, majority of the conditions some of the conditions we will not. So you need to find the best guy to do the guy or girl to do the procedure. So there's another question about ulcerative colitis. Again, ulcerative colitis is a condition which affects, so it's women special. Yes, it affects women, particularly young women and young men too. Basically, it is part of a condition, disease called inflammatory bowel disease. Basically, there's inflammation of the gastrointestinal tract, mouth to the anus. Crohn's is one, Crohn's disease. The other end is ulcerative colitis. Crohn's can affect from mouth to anus, can be a challenge to manage. Ulcerative colitis, in comparison or in contrast, affects only the colon. It starts from the anus and goes up. It could be part of the colon or full bit of the colon. So the inner lining of the colon gets inflamed, right? So it gets inflamed, so it bleeds. It also results in swelling and edema. Edema is like, when the tissues get swollen, and because of that you get very loose stools and bloody diarrhea. It's a very common symptom with ulcerative colitis. Now, it can be limited just to the rectum, and it can be easily treated. When it affects the whole entire colon, then you need to be on stronger medicines. Usually, people respond to medical care, medical therapy. If it doesn't, then you may need surgical intervention. Okay, ulcerative colitis Crohn's disease in comparison again is a challenging condition because it can affect mouth to the anus. Again, we try to manage it medically and try to avoid surgery because it can affect any part of the in ulcerative colitis. Worst case scenario, the colon gets inflamed, you treat it with medicines and it doesn't settle, then you can remove the entire colon, and sometimes you may need to put a bag, but you can form a pouch, ileoanal pouch, which we routinely do at the main hospital of Apollo, and put a pouch inside and get the normal route back. With Crohn's disease, the problem is it can affect one bit and then be normal, another bit. So you don't want to be operating on Crohn's. You want to control it medically and manage it with your medical gastroenterology colleagues, and surgery only if there is a blockage or inflammation, pain, and that's when you do that. Okay, so that's ulcerative colitis. So we got another 10 minutes. Let's see what else is happening. Okay, so Mahendran is my good friend is asking my important development. It's coming, Mahendran. You need to be patient. Having patience is good for all of us. Keep working on the future, but yeah, it will come. Still working on it. It takes time, right? I'm sure all of you agree. We all want to get good things happen straight away, but it doesn't. So, okay. So, any other questions? Please type in. I'm trying to answer your questions, particularly related to women. I said it's a women's special. So, what else can we talked about cancer? Screening. Screening is important. Talking about screening, all screening is important, particularly, in women, breast screening, cervical cancer screening, colorectal screening. Breast screening is easy because most of the time is self-examination, and if not, you can ask your GP or your breast surgeon to examine you. But it's important. Incidence of breast cancer is high in India. And self-examination is simple. You can get lots of information online. I'd suggest that as a special request, all the women, please have do a self-examination. And it's important. Cervical screening, you need to see your gynecologist, and they'll do that for you. And I think that most of them are built-in part of your health check. Master health check. So after the age of 40, I think every year all of you should have a master health checkup on a yearly basis at least. There are several options in the city, and find a good center which does and also a doctor who can go through all these results, because that's important. And to it's very important. We tend to ignore. I've ignored it in the past. So my advice is that after 40, man or woman, every year should have a master health checkup. It's now that there's so many options available, and it's worth investing in health. The pandemic has shown us that health is very important, food is very important, and shelter, housing is those are the three things. All the rest, is an extra. Personally, that's my opinion. So, health, food, shelter, yeah, to stay safe. So that's all is required. That if this pandemic has taught us anything, those three things. So invest in your health, invest in learning new things, because that's helping. I spent a lot of my time learning new things on, online, doing courses, how to, edit videos, of course, operated videos, which normally I'd give to professional, so keep learning a new skill every, whatever age, doesn't matter, all of you. Women particularly have lots of skill sets because they, manage a family, have a baby. Men are less skilled, I think, although we won't openly agree to it, I think that's the truth. But so talking about screening, and for colorectal, now we don't have a colorectal screening program. So that's why because the incidence, as I said, in the Western world, it's 32 per 100,000. In India, it's about 4 per 100,000, but we still have equal number of, as I said, in the subcontinent, there are 70,000 colorectal cancers every year. So there are lots of people who are developing that. So, but we have 1.4 billion people. So it's not possible to have a screening program because it's a question of funding, accessibility, where would you screen them and all that. So as long as we have the awareness that if you have colon or rectal symptoms, which are, again, I tell you because it's very important, the whole point we talking is that these things are there, and rectal bleeding, change in bowel habit, constipation or diarrhea, anemia, weight loss, a lump in the abdomen for more than 6 weeks, get screened. Screening is done by seeing a specialist who will do a rectal examination. The rectal examination is a very important thing. Any anal problem, I know women in particular feel embarrassed, and at several instances they'll come and see me, but they say, "Look, doc, just give me a medicine." I understand the anxieties which go with being embarrassed, but we live in 2020. That doesn't mean that the anxiety is gone and you're not embarrassed. All I'm trying to say is, I think the way I see it, I'm a professional, and it could be doctor, a man, woman, whatever, as long as the right person to do it, the best person to do the job. And I think, I understand if you're embarrassed, women refuse sometimes, but I think it's important to know the right problem and treat it soon, so that sometimes it gets delayed because you don't show anyone or you don't show the right person, and then your treatment gets delayed, and something which could be simple, treated early, within a few weeks, gets delayed, and then you end up with a problem, and you may end up with surgery, and we can avoid all that, right? We can avoid all that. So my suggestion is that find the right person, get the examination done. I understand. I do understand when if people can be embarrassed, mostly women. But I think it's your health, and it's difficult. It's difficult. Yes, I agree. But but also, why suffer? Get the right person to see and make the right diagnosis and get the treatment done, and you don't have to leave the doctors. Good, I hope. Right? Okay, so for screening for colorectal problems, the gold standard, as I said, after a good rectal examination would be a colonoscopy. So it's one of the best tests because you can look inside and then you take some biopsies. Obviously, you need to have some preparation to clear the bowel out. But it can be done safely and without anesthesia, with anesthesia. So, but important thing is to get screened. Screening is so very important for particularly to pick up problems early on. Yeah. So women, please, breast examination, cervical examination, colorectal, GI, keep that in mind. It's very important. And talk to your friends and families. Talk to the senior women in your families or in your neighborhood or in your block of flats, in your street. And it's important to educate them. And okay, so that's that. What else? What else can I talk to you about? Another 4-5 minutes. So there's somebody who has colitis who's got a rectus sigmoiditis. So mesocol works for them. Yeah, it's a good drug. Mesocol enemas are very good, particularly for limited left-sided colitis or proctitis. The enemas work very well because they go directly through the anus into the affected region, and they work amazingly well. Yeah. So that could be tried. That could be tried. You can contact us by email, and I can help you with the reports. Okay, so another few more minutes. Any other questions? So I hope all of you are staying safe with the, as I said, mask, social distance, wash your hands or hand sanitize. It's important, and we'll get through this. We've been through this 4 months, and a few more months, I hope. The vaccine will be some time, but if we can manage and stay healthy and keep fit, we should be able to get through this crisis. And my advice to all of you is, as I advise my friends and patients, is that in every crisis there's opportunity. So I know it could be a challenging time to your family, your finances, friends, health, but just hang in there, and it will get better. As I said, the most basic things are health, food, and shelter. If you can protect those three things, the remaining things will fall into place. Yeah. Okay. So I think we're almost done. And if there are any particular questions, I'm going to directly message back on the chat. Okay. So sooner or later. And it's great meeting you all. So hopefully we'll see you next week. And we'll pick a topic. If you guys want to suggest a topic, do suggest, and we'll pick it up next week. Because as by the end of the year, all of you guys are going to be so experts in this area. You're going to be educating people around you, and and I think that's good, because at least people will one, avoid a problem. Two, if they get a problem, they will seek help. That's what the whole idea behind these things are. To educate, very important. Okay, right, great. See you guys soon. Hopefully next week. Bye bye.